Welcome back to the For Your Best Self podcast. It's Dr. Novo. I'm here with Dr. Saluja, and we're super excited to be bringing you this episode on how to be your best self at every decade. So we're going to work through 20s and beyond. We're going to kind of take turns going back and forth. We'll take a quick break after your 40s, and then we'll finish up. So, Dr. Saluja, not to waste time, in your 20s, patients in your office or future patients, what advice or what do you like to introduce to patients in their 20s?
Well, by the 20s, they're 21, they're exposed to alcohol, but that's not what I introduce. I'm going to introduce a medical grade skin regimen. And I think medical grade skincare is as important as anything, because the increments and the benefits you get, the incremental benefits you get from daily skincare lead to a major benefit over a lifetime, much like good nutrition and going to the gym. So foundation of a medical grade skincare regimen would be your SPF 30 mineral block with zinc or titanium, an antioxidant in the morning to help prevent environmental or reduce environmental damage over time, and brighten the skin and promote skin health. And my favorite nighttime product is vitamin A cream or tretinoin or a retinol. That tretinoin cream is the only topical proven to prevent progression of aging and precancerous changes in the skin.
It's kind of our miracle drug, isn't it?
Yeah, so Retin A, go to bed.
And I thought it was interesting. The reason why we put it on at night is because the products break down with the sunlight.
Right.
So we put that on
So it's not dangerous in sunlight.
Right.
It's that it doesn't work well in sunlight.
Right.
And it doesn't make the skin, tretinoin doesn't make the skin overall more sensitive to sun, other than it exfoliates the skin so there's less dead skin on the surface. And so you would be more sun sensitive, just like any exfoliant would do. And that having less dead skin on the surface also makes you glow. So we do want a thicker living portion of the skin where you have more collagen and less kind of those dead, dull skin cells on top, which so tretinoin is great for that. It is also great at changing kind of the DNA of cells so that they behave younger. Right. So there's less wrinkles, less acne.
Acne,
so it
that's
is
huge. I think it is critical to speak to people in their 20s, because every single patient says, I wish I would have, or if I would have known. It's always that. No one has ever regretted wearing sunscreen or doing good skincare. It's always you feel like you're too late or gotten too much sun, where you've kind of done that damage. So if we could speak to our past, selves, or I think
it'd be start skincare sooner, right? So the foundation, vitamin C, or an antioxidant serum. We happen to use vitamin C as our main antioxidant, sunblock, and tretinoin or vitamin A cream.
Right.
Is a great start. Things you have to add, recommendations you have to add, Dr. Novo, for 20s?
I think that's the most critical, but then synergistically, just developing those good habits. I think it's so much easier to prevent than undo. From an economic and just a healing standpoint. So just making good patterns for lifestyle, not smoking. I usually say smoking and UV are the two biggest things you can do to age more rapidly. Healthy diet, trying to leave out things that are inflammatory in your diet, whether that's gluten or lactose, minimizing. I'm not a, all or nothing person, but I think minimizing things that are inflammatory and causing acne and alcohol. I mean, you mentioned it's one of those things you're introduced to, and overdoing it is dehydrating and it is aging. So just really setting up yourself for good life patterns, healthy diet, exercise. In the 20s, I think in a perfect world, you'd start Hydrafacials. It's probably one of my favorite treatments, where you're getting that really nice cleansing treatment and getting the antioxidants laid into the skin, hydrating. So I think if you could do that every few months, that would be awesome.
I think Hydrafacial allows you to establish a relationship with an esthetician and with our dermatology clinic, and I think that's a good setup for the rest of one's life is to start that relationship early. Have you had a Hydrafacial?
I'm overdue, but it is if in a perfect world I could do that once a month, I'd be the happiest person. But I think it lets your skincare penetrate better. It's going to make more effective skincare, just healthier, glowing skin. And like you said, that relationship, just setting the pattern. And if you don't make time for it or make it a priority, it's going to be a lot harder to catch up.
Hydrafacials make a great gift, great birthday gift. Speaking of age.
Yes. Mother's Day, Father's Day, men. Oh, I love talking to men
in their
about
20s.
Hydrafacials.
Why not?
Because they're so sebaceous and oily, and you just get all that gunk out, and it's just super clean.
Yeah, the best part of the Hydrafacial is seeing the container afterwards and what was removed with the extractions and the peel and then the hydration and infusion.
Awesome. So we could do a whole segment on 20s, but we're going to go into the 30s.
Do you want to talk about hair removal in the 20s
or
the 30s?
Oh, I mean, you could do hair removal in your teens. I wish.
Yeah, let's do teens.
I wish my mom would have gifted me laser hair removal.
Speaking of gifts, graduation.
I mean,
gift.
I'm still asking for it.
No graduation party this year, so why not?
Shaving
Graduation
is
laser
so
hair removal.
Last decade. Yeah, we just got the Modus, which is the true painless hair removal. So that can be done in the office. I think that's a home run for anybody.
Yeah, 6 to 8 treatments, no pain. That's what's miraculous about it. And it works. It's an Alexandrite laser, which is top of the line for hair removal. And why not?
Absolutely.
Right? Save time. Speaking of lifetime benefits, save time over your lifetime to not have to shave.
We're all impatient. I hate being hairy, but, I hate shaving too. Okay, so in your 30s, I'd say this is kind of the sweet spot for probably introducing neurotoxin, the prejuvenation phase.
So neurotoxin or neuromodulators are Botox, Dysport, Jeuveau, and in the 30s is a great time to introduce because they can be part of a prejuvenation plan, which means prevent the wrinkles, right? We just talked about prevention is better than correction. And it's great for wrinkles caused by muscles, the action of the nervous system on the muscles. That's why they're called a neuromodulator. And so the wrinkles that are in between the brows, around the eyes, even upper lip, lower lip, wrinkles that might be starting to form, chin dimpling, masseter, strong jaw muscle. We can use it for sometimes to enhance even the jawline look, but predominantly in that furrow between the brows and the forehead and around the eyes is where Botox, Dysport, the magic is. And
consistency is best.
Yes. So, the nice part is when you're in your 30s, you need a lighter dose, and you can often get away with 2 or 3 times a year treatment as opposed to 4 times a year treatment. And so it's a really effective both and value-based treatment in your 30s. And then the other exciting thing I like to do in the 30s is lip enhancement. It's an introduction to filler. So hyaluronic acid fillers like Juvederm and Restylane rehydrate the lips and just enhance your natural features. So it can be very subtle, or it can be bolder. You have the option when you're younger, whereas as we age, the bolder lip is harder to carry off. So 30s gives us that flexibility.
I love the lips you do. I mean, those are some of the happiest patients, get the selfies, and it's always pretty. It's always natural and fitting and proportionate.
Oh, thank you.
Lips should not look strange, or you don't want that to be,
No, one of the ways we
distractor.
look at lips is at rest and then also at movement. How do they look after movement? And there's a new HA filler that I'm excited about called Restylane Kiss, Kysse.
Perfect.
And it's a great name. And it's just been approved and launching, designed specifically for a natural lip, both at rest and in movement. And I'm excited to be injecting Restylane Kiss.
Talking about new things that sound super sexy and everybody's like, I want this. Can you talk about the Aqua Gold yet?
Sure.
The facial?
Sure. Aqua Gold also called a liquid gold facial or the red carpet facial, is a very nice introduction to Botox, Dysport, the neuromodulators, plus a little bit of hyaluronic acid filler. If you're worried about, you shouldn't even be worried, but if you'd like to try Botox, Dysport, and filler in kind of small doses and really work on complexion without necessarily working on movement or a lip enhancement, let's say you just, I want global improvement in my skin. We actually mix the Botox and the Restylane in saline, salt water, in a sterile container, and little gold needles, that's what we call it, gold facial or the red carpet facial, little gold needles that are so tiny you can't even feel them. You don't need numbing. You don't need downtime.
That's awesome.
Infuse those, infuse the products, the filler and the Botox combination in very dilute, small volumes, small quantities to the entire face to help with complexion,
airbrush.
porous texture for the airbrush look.
I want to get one.
So
I
it's
can't
great
wait.
for an event before, a week before. Do you have suggestions for the 30s?
I love microneedling. Again, these are kind of busy people that don't want or need a lot of healing time or recovery time. So I love if you could do quarterly microneedling to stimulate that collagen. And this is usually where I'm doing a lot of Kybella, just for kind of that stubborn fat under the chin.
Yeah.
You know,
Is Kybella related
contour.
to weight?
It can be. You mean Kybella treatment?
Yeah.
A lot of it's genetic.
Yeah.
But, you know, these are kind of healthy, fit people that just have a little bit of stubborn pockets. So typically we're treating it when it's kind of resistant to weight loss. But this is also the decade where I'm doing a lot of breast enhancement, breast augmentation. But I think it is important to know in these young, healthy patients that, you know, what is the recommendation on implants now if I want to have breast enhancement in my 30s? So a thorough family history, you know, an exam by a physician, and then really education and counseling that these are not lifetime devices. So many patients aren't told or educated that you're going to have or need a future surgery in your lifetime to replace them, or there's no time stamp, there's no 10-year expiration. We know that the wear and tear goes down, likelihood that it's going to rupture goes up after 10 years, but just understanding that you're going to need future surgery in your lifetime. I think that's the biggest understanding. And then there are some imaging surveillance that we recommend for silicone, but saline, there's no extra surveillance.
So still a popular treatment in the 30s,
safe.
And safe.
Yeah. I take out as much that we put in.
Sounds good. You know, one of the things to consider adding to the skin care regimen is an eye cream at this time.
Absolutely.
So with the microneedling stimulating the collagen, including underneath the eyes, and then we're continuing our skin care and adding an eye cream. One of our curated products is Elastin eye cream to increase the elasticity underneath the eye, so there's less looseness.
Yep. I have all my pre- and post-op patients on that. I'm on it. It's that hydration and continues that elasticity.
It's great.
Awesome.
Collagen stimulation in your 30s.
So for
I like it.
40s, what's your most popular procedure that you do on patients in their 40s?
Facial revolumization with fillers is by far the most popular. At this point, you know, if you haven't started Botox, it's time to start. But we are starting at both men and women to see volume loss in their faces, and that's bone loss, fat loss, and collagen loss. So it's not just skin, but the structures underlying skin.
It's restorative. You know, it's not just augmenting.
We're not just augmenting or enhancing, we're also restoring. So we can help the face look refreshed, a little bit younger, not necessarily any different than you are, or look, we don't have to enhance features, we can simply restore. And or we can also enhance. And the two most popular areas to enhance are cheekbones and jawline. And as long as we're maintaining balance in the face, then everything looks natural.
Right.
So it's often a matter of not injecting just one area, but in mapping out the face. And if, you know, we inject the cheek, then we inject a little bit in the lower face. If we're going to inject centrally, then we inject a little bit laterally for balance, because balance and harmony are beautiful. And if we start focusing on one area too much and neglect the others, then that's where something
stands off.
Yeah, looks off. You don't always know what it is, but you know there's something off.
Proportionately, yeah.
And that's one of the reasons our practice is busy, is I think we have the foundation in dermatology and plastic surgery to be able to look for that balance and proportion. And with fillers, there is some recovery and there is some risk. So safety and the aftercare start to matter, where there is some of that swelling downtime. But it can be controlled and minimized. So it's a nice thing to do, and take a couple days of the weekend and get back on to your schedule on Mondays. So that's, for me in the 40s, that's probably the biggest addition. I also, one of the fillers I like to do is Sculptra. The Sculptra stimulates your own collagen. So for people who want a little bit of a secret to anti-aging, or a subtle form of anti-aging that occurs where volume or restoration occurs over 90 days rather than the weekend, we do treatments with Sculptra. So there's a gradual improvement and slowing down as well. We call it evolved aging, slowing down of the aging process. What about you for 40s?
40s typically is kind of that mommy makeover stage. Either the breasts are a little bit flat after having kids, or there's more skin, tummy that they want to correct. So it's probably the most common procedure. I also like doing, some patients have extra skin on their upper eyelids, so that's common in their 40s or 50s, which we'll get to shortly. But often in the 40s, I'll do some light resurfacing as well. Say they have a lot of sun damage, especially in Florida. People that want to be a little bit, have a little bit stronger treatment and the skin reset. We can do that in the office as well with the fractionated CO2.
Yeah, I think laser's one of the neatest procedures you do, because bare skin is really in, and when you wear foundation as you get older, you look even older. So a treatment like laser, where you can eliminate the need for foundation, is
tinted
wonderful.
Sunscreen is the new makeup.
Yeah.
Awesome. We're going to go to a quick little break, and then we'll get to 50s and beyond. So stay tuned.
Hey, this is Trisha Schmalhofer, hostess of BAM, Badasses, Alchemists, and Mystics. This podcast is all about seeking knowledge, talking to experts, changing perspectives, channeling wisdom, and shifting consciousness. Listen as we invite a different badass guest each time from a variety of career fields who are living their purpose, spreading light, giving strength and hope, and changing lives every day. We stream live on Facebook, so like our page, interact with us, and watch the behind-the-scenes action. Find BAM, Badasses, Alchemists, and Mystics on Spotify, iHeartRadio, and Apple Podcasts under Space Coast Podcast Network. BAM!
Are you in the market for a new home? Perhaps you need to sell your old home and downsize or relocate. Hey there, my name is Jesse Hall with eXp Realty, and I offer professional real estate services right here on the Space Coast. Give me a call, 321-877-8737 for all of your real estate needs. Again, 321-877-8737 for all of your real estate needs. Buy, sell, invest with the best. Find out more at 321-buysellinvest.com.
Welcome back. It's Dr. Saluja, Dr. Novo here, Dermatology plus Plastic Surgery for Your Best Self podcast. We are going to pick back up with the 50s and beyond. We're talking about how to take care of yourself, how to be your best in every decade. I think in your 50s is perfect to kind of speak to the synergy of your practice, because I think one of my favorite combinations is when I often tell patients we need to work on the skin first. I mean, there's definitely people that want and need an instant gratification, and we can achieve that. But I usually think that the best result is when we start with the skin and then we work deeper. So a lot of the times I'll reset the skin with the resurfacing, which we just spoke on. Obviously, they're already doing great skincare, or we wouldn't do the laser. So they're set up with their skincare. I resurface. Often I'll combine that with an upper blepharoplasty, because these are things we can do comfortably in the office. And then I tell them
What's the recovery on the blepharoplasty?
So sutures come out in 5 to 7 days, and you might have a little bit of swelling, bruising in the next second week, but really you're presentable after a week.
Awesome.
I usually tell people to wear glasses to kind of conceal or distract, but my favorite process is then I send them to you and they kind of finish it off with a liquid lift. And I think those are some of the most beautiful transformations.
Yeah, that's where the synergy does show through.
Yeah.
And I love doing liquid lifts once the skin
Better.
has been lasered and is healthier. It's so hard as a dermatologist to do fillers when there's spots that still need removed or complexion that still needs to be cleared. And once the skin is glowing, we can focus on the deeper layers of the skin, such as the fat of the skin and the muscle and the bone. And so the liquid lifts that I do range from a couple of fillers to a whole Y lift, which may be 8 or more syringes of filler. And I tell people not to worry about the amount of filler we're putting in, because each syringe really only has 1/5 of a teaspoon. So it's not that we're filling your whole face. We're highlighting portions of the face. So it's, and we're placing a lot of the filler over bone where we can. So it looks like you have great bone structure rather than full skin, if that makes sense. And so the Y lift or the mini Y lift or the Dr. Saluja signature lifts are about, globally looking at temples, looking at cheekbones, looking at under eyes, looking at nasolabial folds, marionettes, chin, jawline, and creating a plan and then implementing it either in one visit or multiple visits.
I love
with
that it's
Botox
something, like you said,
filler.
you can build on it. You're going to give each patient customized what they need and where they need it to restore and shape beautifully.
Yeah, that's lots of fun. So can still have fun in your 50s, right?
Absolutely.
So what do you think about the 60s?
This is usually when patients are complaining about their jowls and their neck. So it's going to be combined with, I try to keep things to the face. So eyelids and lower face and neck lift are really common in the 60s and beyond. Everyone says, when do I need surgery, or do I need this? And I usually say, well, nobody needs it, but the timing is right when it bothers you enough to do something about it. You're financially secure.
Is this the most common decade for facelifts, neck lifts?
I
the
think
60s?
so. I think because how far science has come with skincare and injectables, it used to be doing facelifts in the 40s because there were no other tools. And now we're seeing it so far postponed because of medical grade skincare and injectables that it's 50s, 60s.
And it probably can last a lifetime too now because of the aftercare.
Right, because most people would redo it, if they have it in their
That's a
40s,
great
they're
investment.
redoing it in their 60s, whereas now patients will come back and we might resurface or do
Right.
subnovi or use non-invasive ways to kind of restore the skin. It doesn't stop aging, so we still have to keep up with everything.
Yeah. But that's neat.
Yeah.
To be able to say, okay, you're set now. You've had this. You just got to maintain.
Maintain. Yep. What are you seeing in your
Yeah.
60s, or what do you recommend?
Well, this is a time to make sure we're hydrating the skin well. So we're going to continue our skincare, but we might have to make some adjustments over time, especially in the 60s, looking at hydration to improve skin. So, our moisturizer or hydrator might now start having peptides, might be what we call a higher hydration factor than younger. Some of our patients start getting more peach fuzz on their faces as they get into their 60s, and dermaplaning facials are a wonderful way to exfoliate, enhance product penetration, skincare product penetration, but also tackle peach fuzz. And so this is also a time where a lot of our patients, their kids are grown up, right? So it's time for self-care.
Right.
So I think that the glowing facials, the kind of the enhanced products, and maybe another step or two with skincare at home is nice, because this really is when for a lot of people they have time to really do kind of indulge in that self-care.
Right. And it is an investment, and that's how we look at it, but it's also a priority. You know, are you going to spend it on a bag or your face? I mean, I would choose my face. So I think that it's just kind of a perspective and a priority of how you are
and I tell a lot of my patients, just like the bag metaphor, I tell them, think of this as your staycation. So you got to schedule some vacations away, and of course in this time we're not scheduling vacations away either, so maybe there's some more time for some staycations, but you also want to schedule some staycations, and that's where you do your self-care and take care of yourself and feel relaxed and rejuvenated, which is sometimes a nicer vacation than traveling and tiring yourself out. So any additional tidbits, Dr. Novo, beyond 60s, or just general things that come up in the practice that we may not have mentioned?
I think ongoing, you know, despite the decade, is always hair health, hair wellness. So we do have supplements, Nutrafol. I love that. It's kind of an
I do too.
all-around benefit, and you've brought up many times the benefit of the anti-stress and anti-oxidative stress and the ashwagandha.
Ashwagandha and curcumin are two of the most helpful stress and inflammation supplements. So in addition to nutrition that we're getting from Nutrafol, we're also getting some of the hormonal benefits in the skin and hair, as well as the anti-stress.
And Lash Care, and not to leave out the priority of an annual skin check. I mean, I think it's important. I've had stuff frozen off me, so that really should start,
you could,
depending on your sun exposure, and continue yearly.
Yeah, yearly skin checks for skin cancer obviously it's going to benefit our whole lifetime, and that's important. It's important to check yourself, but then also get a professional evaluation. And you briefly mentioned Lash Care. I think Latisse is just a fun thing to try. If you love it, continue it. If you don't love it, don't continue it. But it's a fun thing to try and watch those lashes grow.
It definitely is more comfortable than fake eyelashes.
Yeah, some people like the fake ones. Some people want to grow out their own. And it's nice, again, we talk a lot about it's nice to have options.
Right.
And I think we know how to fine-tune the use of Latisse now, which is nice. We can pull back when we're at a place we're happy with. We can minimize irritation by changing its use to the morning or using eye cream first. And so there's a lot of pearls around Latisse and maximizing its use.
Awesome.
So that's cool.
Well, there's so many more things we could talk about. If you have more questions about what you should be doing in your decade, feel free to call the office, 321-241-1160. Check out our website, www.foryourbestself.com. Come in for a consult, and we can come up with a treatment plan that's best for you in the decade that you're at, and plan for where you want to be.
Do we take insurance for the skin checks?
Yes.
We do.
Yep.
Okay, so let's...
We accept most carriers. So
yes, we do. It was a rhetorical question, but yes, we do. Yeah, it's nice sometimes to get introduced to us that way through a skin check.
Right. So check us out, and we're happy to help you and be your guides in whatever decade you might be in. And we'll talk to you soon. Thank you.